A health fair is an educational and interactive event designed for outreach to provide basic preventative medicine and medical screening to people in the community. One such event is coming up in Winter Haven, and you don't want to miss it. All the details are just around the corner on Polk Place. Welcome to Polk Place. I'm your host, Jeremy Morady, and with me here in the studio, we've got two wonderful guests, Dr. Ruben Perez, who's a board-certified internal medicine physician with the Heart of Florida Physicians Group, and also we have Cindy Moore, who's a family nurse practitioner certified with also the Heart of Florida Physicians Group. So thank you guys so much for coming in.
Hey, good morning.
Thank you.
How are you?
Good morning.
Good morning.
You guys have got a wonderful event coming up. Health fair to kind of tackle a number of issues for folks in the community.
Right.
Kick us off. Tell us what
Sure.
to expect and what people can do to come out and see you.
Sure. This event will take place on May the 19th from 8 o'clock to 10 o'clock in the morning. We'll be offering screening for different conditions, including hypertension, screening for diabetes, screening also for high cholesterol. As part of the event, we'll also be hosting a half an hour to 45-minute conference on common topics such as dementia, memory loss, urinary incontinence, common things that are normally seen in people as they age. Depending on the outcome and the number of people showing up for that first event, then we'll determine if we have more events in the future.
Mm-hmm.
Or if we get a good turnout, we'll be hopefully inviting doctors on different specialists, specialties to come in and do a talk on different conditions. We have a cardiologist that can come in and do some talks on hypertension, heart disease. We have a urologist in our group that can come in and talk about issues with prostate, urinary incontinence. We also have our nurse practitioner, Cindy Moore, which is also very good in doing preventive screening and also can do a talk on different kind of preventive issues. But it'll be a very, very good event. We have a good group in our office, very friendly staff, and we'll be happy to have everybody there.
You've been practicing in Polk County for a while now, haven't you?
Yeah, I initially came to Winter Haven in 1996, and I joined the Gessler Clinic. I was with them for 15 years. Then I've moved to Plant City for 3 years. Then I eventually moved to the Davenport area, started my own practice initially for the first year. And then I joined the Heart of Florida Hospital 2 years ago, and I've been with them now for a couple of years.
Well, I'm kind of curious, in that amount of time, you've seen patients, I'm sure, from all walks of life.
Right.
What are the things that something like a health fair like this, what do you expect to see, and what types of things can people really get out of it? I know, you hear about like the shortened time spans that patients get to spend with doctors these days, mm-hmm. The way that medicine's structured here, but it seems like this is going to be kind of more of a hands-on, mm-hmm. personal kind of situation right. here. Can you talk a little bit to that?
Sure. One of the things I like patients to get to know me. I've been here for since 1996, so I believe that's about 22 years now.
Let's not do the math.
But I like patients to get to know me. I like them to feel comfortable talking to physicians. Know that there's some of us still out there that I consider myself an old-fashioned type of physician. I feel to have patients to feel comfortable approaching me, asking any question. Will also make patients aware about common symptoms of different conditions such as diabetes, hypertension, high cholesterol, what can be common symptoms in those conditions, so they can learn to recognize the symptoms and then approach a physician about it. I would like them to also think of us as a resource if they need any kind of medical help. Make sure they know we're available. make sure we know we have a good network, that if we diagnose something, sometimes having a network of physicians actually facilitates getting a patient referred to a doctor right away, as opposed to waiting 3 months for a consultation. I can get on the phone with my
right in that
cardiologist
system already.
right, and get him a patient in within a couple of days, 3 days. Same thing with a urologist. So it really facilitates also patient care, allows patient care to be much quicker. I think the satisfaction overall from patients will be much better, because again, we have the network and we can just get them in quickly to see any of the doctors that we have in our network.
Okay.
Yeah.
Now, with the screenings you're going to be doing, will they be able to get their results right then, or
Yep.
is there some lag time? Or
Yeah, pretty much. It takes about a minute to get your sugar, blood pressure, of course, we get right away. Cholesterol, it takes just a few minutes for the machine to give you a cholesterol reading.
Oh, wow.
So the results will be there right away. And then we can, once we get the results, let's say somebody comes in and they had no idea they were diabetic, and based on the test we diagnose diabetes, then we can give them a little bit of guidance and some information as to where to go from there.
Okay.
Yeah.
Now, do they need to bring anything with them when they come that day?
The only thing, if they're planning to do some of the tests that we're going to be offering, we asked them to just come in fasting, so that we get some accurate readings on the cholesterol, get some accurate readings on the blood sugar. If they don't come,
Like fasting the night before, or?
the night before, nothing to eat the night before, they can have water. If they forget, we can still do the test, and we take into consideration if they're not fasting, but we can interpret the value based on whether they're fasting or not. But preferably, we like them to be fasting, nothing to eat for about 6 hours.
Okay, so
Yeah.
no Chick-fil-A, chicken biscuit in
Only
the
if they
morning
bring
the
me
night
some
before.
too.
Okay. You know, in the time that you've been practicing medicine, that you know, a lot has changed in the county. There's so much cultural diversity. What if someone doesn't speak English? You know, coming into this, is there something that you guys can do for them?
Yeah, so my first language is Spanish, and so is Dr. Perez's.
Right.
So we're both bilingual, so we do offer that in the office. We also, one of the things that sets us apart is that we're very friendly. We have friendly staff. Dr. Perez and I talk to patients. We get to know them first. So if you're a new patient, we sit down with you, we talk before we even talk about any medical problems that they may have that day or any concerns that they have. We get to know them, get to know their background. We also introduce ourselves, our background as well. So that's something that our office really has. And then we just have this really strong relationship with the patients that we currently have.
Yeah, just to add to what Sandy said here today, we also tend to kid around sometimes about the fact that in our office, hugs are free. We are very, very friendly. One of my mottos for practice, and it's been for the last 22 years, is that they always think, if that was my mom, that was my dad, what would I do for them? How would I treat them? And usually that turns out into the best outcome and best treatment. Patients really appreciate it. Sometimes they come in, and sometimes all they want to do is talk. Had a lady that came in because her dog had died, and she was very depressed about it. We just talked about the fact her dog had died, and she was depressed, how to help her out, how to make that better. And so it's not always a very professional visit. Many times you just keeping it down to earth, just making them feel like we're their friends, and we are, and that's what we're there for. Sometimes they just need a shoulder to cry on, and we provide the shoulder to cry on. Sometimes they need a hug, and we give them the hug, whatever it takes.
All right.
Right.
Well, thank you guys so much for coming in. Look forward to the health fair, and hope you guys can see a lot of folks and get them a lot of help.
Yep.
Thank
Look
you.
forward to it.
Thank
Thank
you
you.
so much.
Thank you.
Thank you.
Heart of Florida Physicians Group invites you to their health fair Saturday, May 19th from 8 to 10 a.m. at their facility located at 350 First Street in Winter Haven. The event is free and open to the public. Free screenings of blood pressure, glucose, cholesterol, and body weight mass index are just some of the things planned. Attendees will be able to chat briefly with Dr. Perez and his nurse practitioner. For more information, you can give them a call at 866-997-DOCS, which is also 3627, or look them up on the web at www.heartoffloridaphysiciansgroup.com.